All right. Again, welcome, depending on where you're at the state. Welcome to a nice snowy morning here in Colorado, or at least cold. Today is Wednesday the 11th. So we'd like to introduce our team really quickly. We're all from an organization called Change Matrix. Rochelle Espiritu, myself, Alina Taniuchi, and Eve Kucharski. And again, Lucia Francis from the Colorado Language Connection. So we're thrilled to have you with us this morning. We can go ahead to the next slide, our Zoom and group agreements. We just ask you that if you can, please stay on camera because this will be interactive. There will be a time in our session this morning too, where you'll be in small group and being able to process and talk to each other. Otherwise, if this is an issue for you, please put an asterisk by your name so we as presenters know that you'll only be listening only today. Please interact in the chat when asked, and then please save your questions until the end of the presentation unless otherwise prompted by one of us as presenters. Again, the live English Spanish translation is available by pressing the interpretation button at the bottom of your screen. And once again, the session will be recorded and posted online. Please send a private message to Alina if you would prefer your verbal chat responses not to be recorded. So in the chat space, we'd love for you to let us know what is one thing that impacts you most when you read, watch, or listen to an effective story. And you could also unmute and let us know that as well if you'd like. What is one thing that impacts you most when you read, watch, or listen to an effective story? You can either put it in the chat or you can unmute.
I can take this one to get us started, if that's helpful.
Thank you.
For me, I think, and I'm a little bit biased because I help work on the storytelling portion of the Colorado Academic Compasses site. So we'll get into that a little bit later. But I think it's really that emotional connection to the content. And so when we think about really the sort of the humans behind the numbers in the sense of data storytelling, really. So for me, it's just emotional connection to whatever I'm reading, watching, listening to. It doesn't matter the format. I think that is most important for me.
Yes, Melissa, the application connection to my life. I think I agree with you. I was just going to say something similar. When the story really impacts me in some way, emotionally or mentally. Zach says, I always appreciate when many of the cause effects are related through a longer story narrative, at least when possible. Seeing the actions were made and then looking for those effects, giving folks credit for the effort. Ariel said the emotion or emotions of the storyteller. Yes. Great. Welcome for those of you that are joining us. We just have a connection, community builder question. What's one thing that impacts you most when you read, watch, or listen to an effective story? You can put it in chat or you can unmute. Nicole says, understanding of where others are coming from and the connections to others and how we intertwine. Yeah, so I think the common maybe thread through all of these responses so far is this idea of connection, that the story is captivating, that there's cause and effect, and that somehow we're connected to that story. And maybe even it triggers some emotion. Would anybody like to unmute and say anything? Great. Well, for time's sake, we'll keep moving. I'm going to turn it over to Alina, but you can go ahead and continue to put the responses in the chat if you'd like. And Alina is going to tell us a little bit about the rest of our series.
Thanks, Scott, and thanks everyone for joining today. For those who joined us before, I see some familiar faces and names, so it's good to have you back. This may be a little bit of a refresher, but we wanted to go over what else you can expect coming up. So we've got session 3 in 2 weeks, which is what data is available. Session 4, where are the gaps in the data? Session 5, what does data mean? How does it reflect what the community is seeing and experiencing? Session 6 is how do we gather and share stories? And then session 7 will be bringing it all together. And so we hope that you will join us for all of the next upcoming sessions. We really do believe that you all will get the most out of it if you can join through the entire experience, and we recognize that other things come up. So as Eve and Scott mentioned earlier, we are recording these sessions, and we'll send up follow-ups to everyone who has registered for attending, recognizing that we can't all be in the same place at the same time. So to that end, we are actually hoping to provide a worksheet that you can use for today's session, and then we'll continue to build on it through each of these sessions as well. I'm going to pause the screen share so I can show you, give you a little preview of what that will look like on one of my many screens here. Okay, so this is a Google Slides doc that we have created. Each of the sessions, we're trying to keep it very high level, but we'll be prompting you at different points in time to fill out this document in order to start building your data story. Trying to make this a very bite-sized pieces type of situation. So you'll see that there's kind of an overview, there's some instructions on how to make a copy, which I will go over in a second. There are some spaces that if you'd like to, you can fill out, and a little bit more that you can kind of bring it back together. But as we go on through the sessions, we will add new slides. And in your copy, you can make a copy of the new slide that we're adding and put it into yours. And we'll prompt you during our sessions to fill it out. And hopefully by the end of this, you'll have kind of a nice little story outline through this document. You should notice that it will kind of go along those same 6 story steps, creating a data story that we've shared with you before and that our sessions are following. So hopefully this feels familiar, but it's just a little bit farther away to break down, and you can take notes in this so that you can start to develop and change your story if and as you go through the process and you're thinking, oh, actually, I'm seeing a different story develop than I thought originally. So I think our team has shared that in the chat, which is great. I think you'll probably have permissions to view it only, but the way that you make your own document is to go up here and click File, make a copy, and then you can select the entire presentation. So for everyone here today, this is new. You'll do the entire presentation. At another session, say the next one, we will provide these same instructions to folks in case we have new ones joining us. But for you, you can just select the slide that you would like to make a copy of and then make a copy into your own document so you can continue to build off of it. As much as we would love to have an entire working document for everyone to be in, we don't want any of your work to get lost, or we don't want you to feel like you can't take the notes that you would like to take. So we welcome you to create your own document, keep it in a safe space, and we will ask at the end of it, if you would like, you can share your stories with us. We would incredibly welcome that, but we do want to make sure that everyone's stories and work stays safe and in your own place. So that's a little bit about what we're trying to do. If you have any questions, please let Eva or I know, and we can make sure that we can help you get that into that document, create your own. And as we go along in the process, excited to see what you all come up with. So I'm going to get us back to our slides now. All right. And then I will pass it over to Scott to begin our session today.
Thank you so much again. This is our model again for documenting our story and our journey. And we are looking at defining this area of focus, and our upcoming sessions again will all link. So we hope that you'll be able to join us then. So we're going to turn to the chat space again. And this time we're going to ask you just to put in a single number on the next slide. 1 to 5. What is your familiarity with the social determinants of health? 1 being very little or none. This is brand new to me. Or 5 being I've had a ton of experience and I know all about them and I could probably lead a lecture on them. Okay. And then of course the numbers in between, you can gauge what is your familiarity with the social determinants of health. Good, thank you. All right. Wonderful. I'm going to just, you don't have to accept, but I'm going to ask Ariel, would you mind unmuting and just saying, why did you put a 4? What's your experience been? And where did you learn about it?
Yes, so my experience has been a combination of school and through work. So I have a Master of Public Health, and I'm currently working as a public health planning analyst at Pitkin County. And I'm doing a lot of work around social determinants of health for our community health assessment and public health improvement plan.
Wonderful. Thank you so much. How about Melissa or Nicole? You also rated that pretty high. What's your experience been, and where did you learn about the social determinants of health?
So mine is all practical experience with work, and just going through data and seeing how the social determinants of health apply to our local areas.
Thank you. Thank you, Nicole. How about Melissa, if you're willing to unmute? Or did you learn about the social determinants? Oh, I'm so sorry. I see your asterisk. Okay. It's my eyes. So thank you. You put it in the chat. A lot of school research papers. Yes. So a lot of school work. So we're going to just do a quick overview of it and then talk about it as both a theoretical construct and then how important it is for us as a foundational piece of storytelling and how to get started with storytelling. So the next slide, this is directly from the Colorado Equity Compass. So this is the graphic that we have and a quick definition of how we talk about the social determinants of health on the CEC site. So you'll see, and as you look, if you look, do a search on the social determinants, you'll see some classify them with 5 categories, some like where we have 6. I've seen some with 4, I've seen some with more than 6. So the important thing is there are categories and then there's a lot of subcategories, and we'll talk a little bit more about that. So the way that we are defining this within the Colorado Equity Compass is that health equity is impacted by many factors other than just healthcare. And these factors are known as social determinants of health. And they are key to understanding the well-being of communities in our state. Okay. And then again, the 6 areas that we have categorized as education, built environment, social context, economic stability, health and healthcare, and environment. And then within the Colorado Equity Compass, we have data that we pulled from these 6 areas that you can also take a look at and explore in many different ways and capacities. Okay. So this this visual and this graphic comes from the County Health Rankings model from 2016. And this is really an interesting model because it shows the complexity of the social determinants and also what really leads to health outcomes. And so there's been a lot of research, especially in the last 10 or 15 years, on how the social determinants really are the factors that determine health outcomes, apart from just quality healthcare. Okay, this includes concepts around equity, such as institutional equity issues, systemic equity issues, and then interpersonal and intrapersonal equity issues. They show up on the left-hand side in policies and programs, especially when we're talking about institutional and systemic types of inequities, right? One question that I think is a great equity question when we're thinking about policies and health policies or programs is, does this policy or program benefit some and serve as a disadvantage to others? And if we can say yes to that, then it is easily identifiable as one that causes inequities. And so you'll take a look there in the middle columns around the physical environment, the social economic factors, clinical care, and the health behaviors. And you'll see that those add to 100%. And so this is, again, this particular research that shows the impact that these particular categories have on overall health outcomes. Okay. And so the physical environment includes things like air quality, housing and transportation, social and economic factors, which equate to 40% in this particular research. 40% of health outcomes include education, employment, income, family and social support, and community. And then clinical care includes access to care, number one, and then the quality of care that you're receiving. And then the health behaviors include tobacco use, diet and exercise, alcohol and drug use, and sexual activity. And the health outcomes, which can increase, are the length of life and the quality of life, which if these things are all working in a positive way, then they can increase the length of life and quality of life by 50%. So anyway, this is the point of this being, it's a very complex system of inequalities and even disparities, et cetera, that have existed over a long period of time. And that's why we call them systemic and or institutional. Okay. So when telling a story, this is one entry point where you could take a look at the social determinants of health, or maybe one of the social determinants of health. You could think about it in terms of this, this visual where you could hyper focus on one maybe strand, education. Maybe there's a story in there, but how it connects again back to health factors, health outcomes, or policies and programs, right? So when you're thinking about getting started, this is a really great place to think about what are those social determinants within your community? What are the most prevalent social, not only social determinants, but equity outcomes or inequities that are occurring within your communities? And how can you highlight a story that also connects to the health aspect that you want to highlight? Okay. Any questions on this or comments on this particular graphic? Okay, we can move on. So this quote is from Dave Chosky. He's really been a major player on especially on the East Coast, but also on a national and even worldwide scale in the New York Department of Health, in other arenas. Also a doctor that practices within one of the hospitals there in New York. So his quote is, "I think that my patient with diabetes whose blood glucose levels I haven't been able to get under control because he can't take the insulin I prescribe because he lives in a homeless shelter and has no place to refrigerate it. Or the person with advanced liver disease related to alcohol use, which is exacerbated by his sporadic employment. when you trace back to the causes of illness, in so many cases, you see how our social fabric itself is in need of mending. We can go to the next slide because this is important because I want to bring up this idea of intersectionality. Okay, so we can't just focus on the liver disease in this case, right? Without looking at the other social factors that affect that as in his words, the sporadic up and down, right? Depending on the employment, depending on other factors. So this idea of intersectionality, it describes the ways in which systems of inequality based on gender, race, ethnicity, et cetera, intersect to create unique dynamics and effects. All forms of inequality are mutually reinforcing and must therefore be analyzed and addressed simultaneously to prevent one form of inequality from reinforcing another. Okay, this concept of intersectionality, and this comes from the Center for Intersectional Justice. The concept of intersectionality was developed, I believe, in the 90s by a professor named Kimberly Crenshaw. She's a professor in the law school in both UCLA and Columbia universities. And she was sitting with this notion of how her own experience as an African-American woman with a JD degree was experiencing all of these different inequities within the education systems that she had been brought up in and a part of. And so she came up with this concept that the barriers are not just singularly focused, especially that she was facing, right? So you couldn't just look at her as African-American, you need to look at her gender and her experiences as an African-American and her experiences in higher education, so on and so on and so on. Okay. So this comes back to that first graphic that we looked at and really the complexity of intersection. So I really want to just highlight this point as you're thinking about your story, or you're thinking about an individual who you might have a story that you want to highlight, or individuals, think about the intersectionality so that their story isn't just one dimensional and neither are they. And so therefore, what can we do to uncover that? And also as we get into our future sessions, when you're looking at data, or you're looking at data to support the work that you're looking at it in this intersectional way. So if we can go to the next slide, this is a nice visual to kind of think about that, right? We have our 6 core determinants of health, our social determinants, again, that are on our Colorado Equity Compass. And this is just a little bit of the idea of that intersectionality, how they all come together in the middle, right? So there could be one person that has all of these different dynamics or factors that intersect in the middle of their own being, right? Just as we all do, and that really have impacted their overall experience. So when we're asking questions, if you're doing like an interview or a focus group, make sure that you're really thinking about and getting to the core of these different intersectional elements. And we can go to the next slide. So again, just please share in the chat space, or if you'd like to unmute. Now that we've gone over this a little bit, and several of you have had some experience of your own, but how have the social determinants of health impacted and or influenced your own life and work? So think about all those concepts. We just talked about social determinants of health, intersectionality, all the inequities that exist within these different categories that we've talked about. So how has all of that impacted you personally and or your work? Impacted or influenced? And you know, we love it when you unmute. So if you feel so bold, please do. Yeah, that's right. Pitkin County and several of the other, I would also just lift up many of the resort communities in the mountains, right, are the same, whether it's Pitkin or it's Lake County or it's Summit County or it's Steamboat area, there's this phenomenon where there's all these smaller communities where people and many people of color live also that support the larger communities. I'll share it out on, there's a really great documentary that highlights that area that I'll share out by email to you later. Yeah. Okay. And so you're already seeing the picture that's being painted by Ariel. So you can't just talk about the health, right? Or the access to the health care system or the quality of healthcare system, although that could be a focus. You have to also look at the housing. You have to look at wage disparities. You have to look at transportation, et cetera, et cetera. Right? We were doing some work. I was actually doing some work in Aspen with the Aspen Ski Company, and we were just trying to get them to change their mindset because they offered all employees a ski pass, right? And many of the employees were saying, we don't want a ski pass, we want a bus pass. That's what would really help us. And it was such a hard thing to get them to wrap around, like that small change. Like, not everybody goes skiing or knows how to ski. And so even though it seems generous, and it is, it serves to the advantage of some and the disadvantage of others, right? Remember that key question. Okay, I'm going to turn it over so we can keep moving, but if you'd like to, keep putting things in the chat space around that question. How have you been impacted or influenced in your life and work with the social determinants? And I'll turn it over to my partner, Eve.
Thank you so much about that, for sharing that, Scott. And something also to consider as we get into sort of the actual storytelling aspect, right? So we've gone over this intersectionality and then just going over what the social determinants of health are, something important to consider, and something that actually can be evidenced if you go on the Colorado Equity Compass Equity Data Navigator, that people who live just streets apart can have vastly different health outcomes. And you can see that from the census tract level, the different communities. So something that I certainly encourage people to go over. But now that we've sort of talked about that, I'd like to actually get into the focus of what is the story you are trying to tell, and how do you get an area of focus secured when you're thinking about this? Because, you know, we all know that creating a compelling story begins with an engaging topic, but it's not always quite so simple to find one. That's why it's important to use an approach that matches the needs of your audience, your own capacity, and also remember that thinking of your topic through a lens of intersectionality is not only an equitable thing to do, but it provides potentially new perspectives that can help you reevaluate and think of topics you might have missed out on before. So essentially stepping outside of yourself and thinking about the experience of somebody who maybe English is a second language, or perhaps they have that built environment issue where, for instance, getting to work for them, as was mentioned in the chat before, requires an hour-long commute, or perhaps a bus pass or something like that. So there's all of this to consider when creating a story about health equity and data. So here are just a few examples to get you started. And I, in my previous work as a journalist, these are sort of tried and true methods that I would use to sort of get into the headspace of what is a story that I'm really trying to communicate to the public. So I encourage you to use these methods to get started. So first, are you trying to focus on a problem? And that is something that I think people very frequently do when they get started with storytelling. They just identify, there is low educational attainment in an area, or inaccessibility to food. And that is certainly a very valid way to start thinking about storytelling and the whole process of it. But that can be a deficits-based approach when storytelling. So just to keep things from an equitable perspective, I'd like to provide an example of an asset-based solution on the part of the community, which also is a great way to sort of flip that script and not only think about, all right, this is a social determinant of health challenge that maybe somebody in my community is facing, but this is what they did to maybe fix it or make it better somewhat. So I actually have an example from the Summit Center Food Bank. They were offering a bunch of canned food and dry packaged food to the community. And they noticed that there was actually kind of low participation in it. And initially they thought, oh, maybe this is a language barrier issue. Perhaps people just don't understand what we are trying to do. But they did a little bit of digging and they found out that there was a bunch of cultural factors at play. Many of the residents who were receiving canned food were either unfamiliar with the food itself or even canned products in general, because many of them were immigrants who came from places where food came fresh and canned food was not something that they were used to doing or cooking with. And so the food bank and the community got together and they decided to provide culturally responsive teaching sessions to explain how to use the food provided, how to cook it, and maybe create recipes that they could use to adapt to their own cooking styles that are more effective. So that is an example of an asset-based solution that is a great example of a community story that you might be willing to share. Now, I know that you might not necessarily know of something like that that's going on, and that is totally fine, because this is sort of like the exploratory period in terms of determining a focus. But it is interesting to see that there's different avenues that you may go to, problem-based or solution-based. So the last sort of bullet that I have on this slide goes over great starting points. We are shamelessly self-promoting here. We would love for you to go on the CEC Equity Data Navigator and find those data points. So it's easy to get a data point where, let's say you see somebody, a county is below state average, let's say in educational attainment or another social determinant of health. That could be a data point that you might be able to fixate on, but there's also counties that are exceeding expectations regarding state averages. So a good place to start. Then we also have a very robust resources page, which if you attended the first session, you might be familiar with. But if you're not, it gives you not only tools to use different modalities to share your stories, which we will get to in later sessions, thinking about the way that you may want to present your information, but also to get to thinking about how you might source information from communities. And lastly, we have a stories page. There is no shame in actually looking at existing stories, thinking what works for you, thinking about what doesn't, and thinking about how the focus of one story maybe didn't meet the needs that you want in your own storytelling, but maybe could be enhanced. And that is a great way and jumping off point to getting started. Next slide, please. So I'd like to get into also thinking about what Scott said earlier about thinking about the social determinant of health that might be impacting the community the most. That is also a sort of anecdotal piece of evidence, but something that is important to think about because it often provides sort of a qualitative balance to the very quantitative data storytelling as it often shows up in statistics heavy presentations. And I think, when we did our community builder earlier, we talked about how some of the most powerful elements in really effective storytelling is that human element. So I think that that is something to consider whenever presenting any information is, can I add a sort of sense of the community actually being impacted by the social determinant of health rather than presenting facts and figures? Because while those statistics are important, we really need to contextualize them in a human way. And another note that I'd like to point out, many people have come to me and they feel a little bit stumped and they say, oh, well, I don't really know of which data point to start with. There's so many. If you find even one or two that are just interesting to you, chances are that other members of the community will also note that as something that is important and impactful. So that's something to consider as well. Next slide, please. This is also something to consider. Where are you coming from in terms of your own capacity to create a story, but also your intent? That is something to really think through before you define your area of focus. So your thoughts about what makes a good story, if you're working with a group or organization like a nonprofit, let's say, or perhaps you're in a governmental space, is going to be potentially very different than somebody who is an individual, maybe a concerned citizen who lives within a community and sees evidence of let's say, food inaccessibility or built environment challenges every single day. So say you were coming from a group or organization, a really good method to think through just creating a focus area is using what is called the grounded method. And basically all that is developing open questions based on the work that you already do. So I think a lot of people develop a hypothesis and say, I want to get to that answer because I know that this is happening. But something to consider is, let's think about open questions related to our larger projects. And if we can create a focus group maybe, or do a survey and ask the community members that we serve, how is this effective or ineffective? Maybe there is a different point that you can get to and determine a more important area of focus than you thought was necessary at the start. So something to consider. And if you're an individual, that the opposite, the observation or hypothesis approach, and your lived experience is completely valid too, because just because you work for, let's say, a nonprofit or an organization doesn't mean you don't have your own personal experience within storytelling. And that is a completely valid method to incorporate and fold into storytelling. So these two sort of fork off in different paths, but hopefully you're seeing different considerations that might be important to make when determining, all right, what story should I talk about, and maybe what group of stories would be necessary. And then lastly, it's important to think about equity, as mentioned before, when you are doing storytelling. If you're in a group or organization, oh no, I apologize, there looks to be a repeat on this slide, but essentially, it's what we talked to before. If you are coming into this storytelling with an approach that is rooted exclusively in your own perspective, the answers that you're going to get from the community are going to be limited. They are going to be ones that are maybe responsive to an ask that is not asking maybe the right questions, and also maybe not looking at the proper perspectives. Like Scott's example of, let's give ski passes to the employees who work at this resort as a thank you or around it. Well, that's not actually as effective. So something to think about from a group organizational perspective, particularly if you have a lot of resources, and even from an individual perspective, if you go into a community and you begin asking storytelling, like probing questions because you want to determine a focus or topic area, try to think through the perspective of the community, and also really try to have humility, because it is a gift when people do give you their time and energy to talk with you about storytelling topics and their own personal experiences. There is unfortunately a history, as many of us know, and maybe others don't, of really extractive measures by community members or researchers or large organizations or even individual researchers coming into communities, asking them, what issues are you dealing with on a daily basis related to, let's say, social determinants of health or other elements, and then coming out and never talking to those community members again, and then using their data. So that is also something to bear in mind. So I know that was a ton of information that I blew through really quickly. So I'd like to open it up to some questions if you have any. And I know that it's a lot, so perhaps nothing is coming up yet, but please feel free to share in the chat and or maybe offer something by unmuting. I'd love to hear from you. I'll give you a moment because it's a kind of a big ask, but curious if anything's coming up for you in what I just said, or maybe there's some clarification I could provide. And if we're all good, that's good too. I'm glad to, get that info out. Got it, good. All right, well, we'll move on to the next slide, and there'll be like a little bit of a group session later where we can discuss right here, where we can think through these guiding questions. I'm curious, given what we've discussed, what's an area of focus you'd like to explore in your own storytelling, or if you'd like to create a data story? And then what is informing that decision to think through this focus area? So I believe, Scott, and correct me if I'm wrong, we are going to do just a few minutes to think through that, and then we are going to go into small groups to discuss further.
Yeah, that's exactly right. So if you want to, you can just sit with this. If you have something to write with, just to put your thoughts down, and then we'll take that into a small group, as Eve said. So just
We
take a
also
minute.
welcome you to use that, the slide that we created earlier too, and we went over. That should align somewhat with what we're seeing on the slide here.
The tool. We could probably
The
repost
tool.
that in the chat too, if you'd like.
Yeah.
And you're also, please, welcome to unmute and or put something in the chat if you just, we put a lot out there, right? We started with social determinants of health, and we talked about some major concepts around inequities, equity issues, intersectionality, how to kind of take that first step with your story. So as you're putting it all together for yourself, what's coming up for you?
And also, as you think through this, if it is helpful, in the follow-up email to this particular session, I'll share a few story examples of a variety of topics that kind of go into some of the points that I mentioned before, like asset-based and also maybe more deficit-based stories, but thinking through those elements, and then very qualitative versus quantitative story approaches, which are all great to consider when creating your own project. So pretty soon, I think we'll get into small groups. I'm thinking groups of 2 to 3, if I'm not mistaken, right, Scott?
Yeah, I think we'll do groups of 3 just so you can have a little bit of a conversation, but just please in your small groups, reintroduce yourself. So your name again, your role, where in the state you're coming from, maybe a little bit about your background, how long you've been in your role, or how long you've been working within your field. And then here's a couple of prompts for you to think about. So what's an area you'd like to explore in storytelling? And then what is informing your decision? So is it, for example, is it a social determinant of health or one of those sub areas of equity or inequity? Where is it coming from in this idea of informing? Is it your own observations, your work with clients? Is it coming from focus groups or interviews you've done? Does it come from a story you've heard, either from a client or within the community, or is that how you'd like to get that information, et cetera? Okay, so it's your opportunity to kind of put it all together and then share with this small group what your thinking is around exploring this storytelling. Any questions on your tasks? Okay, so again, we just encourage you to put your camera on, and especially in your small groups, and make sure you're in a place where you can communicate in some way, hopefully verbally, but if not, that you can communicate through the chat space with your team. Okay.
Yeah, I think Alina, we've created those rooms, right? Cool. So we will meet back here. No problem. Thank you. Thank you so much. But we'll meet back here in about 20 minutes, let's say, and then we'll do a little bit of a group debrief. So we are down a few people, as you can see. And so what I told Zach and Nicole for context team is just, let's just go back and see if there's any takeaways or maybe any questions that you have specifically about anything that was talked about, or maybe something that you'd like to delve into deeper. Certainly glad to provide that information if you need it. And then we can just let you know about upcoming sessions and other resources that might be helpful to you, whatever your asks or needs may be. So maybe Nicole, I could just start with you. Like, could you maybe tell us a little bit about, why you joined the session, and then if there's anything maybe we can answer. And I know I'm putting you in the hot seat, so if there's nothing on your mind, that's okay too.
That's okay. So we were one of the groups that lost somebody that had to go to a different call. But so me specifically, I just talked about how I am able to find regional data and things like that, but then when it comes to coming to our local area, it's harder to find some of the information and things that I need. And it's because, I don't know why it's because, but there is such an offset between regional and the smaller rural areas because of the differences in size, population wise, and just the difference between the city and the rural farming community and things like that. And we are currently looking at data, and I just went through some of the social determinants of health data wise, and have not been able to take it back to my coalition yet to determine what our focus is going to be. So that's kind of where we are. So I'm not quite sure what areas we're gonna choose to the deepest yet. That's where I was. Zach is working on food disparities and inequities. So I don't, Zach, if you want to talk about, I don't want to talk for you.
Yeah, we had some similar kind of realms and trying to figure out what I can tell with the story. I like to be black and white, numbersy kind of things, and I'm looking at food equity and other social determinants of health in a small rural area. So grabbing that kind of data and information that I want to lean on is not always quite the easiest kind of task in there. And yeah, just trying to figure out what can be relevant to that story and yeah, kind of how to tell that without grabbing, looking at like the equity compass and stuff. It just gets a little thin when I've got 2 counties and maybe like 8 different census tracts, even, getting all the way to the smallest bit, and I've still only got like 4 different things to look at. So yeah, trying to figure out what feels good and what can help guide that story in there. And I guess one other thing I've been kind of considering, I'm at San Juan Basin Public Health down here in Durango, but just kind of seeing what Nicole was talking about and where she was with, I can't remember, what was it, Communities That Care? Yeah. So yeah, trying to, seeing what data, what governmental data and things like that's available, but then also, I've been working with some of the food equity coalitions and other partner organizations there and trying to see what we can get from them, working with those folks who are yeah, a little more on the ground, a little more involved with social services and things there, and maybe trying to see if I can't get, some more coherent information and just a little bit more kind of story stuff from everyone there, and see if I can't get similar information from various organizations. So that way, like, instead of them all giving me just a little bit of this and that, I can have enough to kind of tie things together across several small groups, hopefully, is something I'm looking at for this year.
Yeah, thank you so much for sharing, Nicole and Zach, and Zach specifically. I'm not sure if this would be very helpful to you, and maybe it's something you've already seen, but food access and disparities there was a large sort of topic when we did a story awardee process last year. And we have a lot of just existing stories about that that I could send you that sort of delve into different topics and use statistics outside of also the Colorado Equity Compass that maybe, could be a jumping off point for you if that's helpful in any ways. So I can send you a list of those resources if that is something you'd want.
Yeah, that'd be great. I'm looking for any resources. I've only been around here for about 3 months at San Juan Basin, so I'm still pulling in all sorts of resources, connections, and things to see what else has been going on everywhere.
Yeah, and the partner organizations that we worked with too are usually quite responsive, and maybe can offer some insights and things too. So yeah, I could definitely connect you with some people there if you're interested. Yeah. So curious then if there was. I know that Nicole, you talked about being sort of undecided in your area of focus and sort of thinking through that. And I was just wondering, is there maybe like a specific point or snag that's like kind of part of that? And I apologize if you've already sort of covered that and I missed it.
We just as a coalition haven't come back together yet to
Oh, I see.
to really dig through the data and decide where the disparities are and where we want to focus our work. So we just, I mean, we did 6 years ago, but now we're so I don't know how many of you are familiar with Communities That Care, but it's a cyclical process. So we're coming back we're continuously looking at our data, but we're really doing a hard deep dive right now, again, and then just seeing if we want to continue to focus on our areas or if we need to switch gears in any way. So yeah, that meeting's in like 2 weeks. So
Oh, okay. That's fair. That's fair. Hopefully any of this information can be helpful. And so the worksheet that we had. So Scott, I wonder if you had any questions or asks or additions, and if not, maybe we'll turn to you with other questions and we can wrap up early.
No, I just think as you're again developing the story, this first step, it's always good to challenge your assumptions or just ask yourself, am I making any assumptions when I look at this data? Is the data comprehensive? What is the data telling me? And then how can I balance that maybe with some, end users? I always think of end users, like, is their voice present within this initial stage? So if not, that's potentially another place where you could start. And as I shared that story in Summit County, working with providers and end users, at least with that one story, they had a very different assumptions were being made, right? And they had very different realities. I'll just add one more piece to that story. The providers not only thought the language was a barrier, but they also thought there was a stigma in coming to the food bank. Like, oh, we think, they must really think it's not a great thing to come here or be seen coming here or have to admit they have to come here. And when we did the interviewing with the end users, they were like, no, they said maybe the first time, but they're like, we love coming here. The people are so kind. They really try to communicate with us. So you see what I'm saying? It was like a completely different story. And so when we bring the two together, that's where the magic happened. That's where we were able to really focus on solutions that matter. So just an encouragement to keep questioning. That's another really great question is, am I making any assumptions by looking at this data, or what is this telling me? And then can I challenge those assumptions through some other collection methods?
Yeah, and just to jump off of that point really quickly, also, if you find in like maybe surveys or focus groups that community response doesn't match the numbers that you're seeing, that's also sometimes worth keeping in. I know sometimes people will just avoid those responses, but sometimes it's more telling and points to like a deeper issue, maybe about services not reaching community members, even though maybe the numbers say they are, but they're like the actual local impact isn't as well, it's not as impactful as we think it should be. So great. I think then maybe we can just go into the wrap-up slides just to provide a little bit of information. If you have any story questions and or stories that you would like to submit as you continue this process, please, you can email me at hello@coequitycompass.org. And you can also just visit the site. There's a contact page there that leads to the same place. You can please, if you will, subscribe to our Facebook and Instagram. We have updates and new resources and stories posted all the time. Please join our mailing list, which I will share in the follow-up email. And we have a little poll that we would love for you to take. It's just that quick QR code that you're able to, pull up your phone and just go there, and it will just ask us, hey, what can we improve for next time around or change? So thank you so much for joining us today.
Yeah, exactly, Nicole. You get gold stars for sticking it out, stay in the distance. Virtual gold stars for each of you. And we hope you'll join us next time. It's so great to see you again. So we hope you'll be with us next time.
Yeah. Thanks a lot,
Good.
guys. Catch you next time.
Thank you. Bye-bye.
Thank you.
Thanks, everyone.
Bye.